I'm going to try to cover in roughly 2 hours material that might take you an academic year to learn in a university setting. So I'm going to do the best I can. I've taken all of the slide material that I've had, that I have acquired over the years, and I've been copying photographs out of books, out of journals, a lot of recent journals, trying to get a lot of information that you may see again, those of you who are sitting the boards next month. And when I sat down to put this thing together, I had a lecture that was about 5 hours long. So I had to cut it down to 2. And in my practice sessions, I've had to hurry through it. I don't want to do that. I want to take my time. So if I run a little bit over, I hope you'll excuse me. I've broken the talk down into 2 parts, basically. First, I'm going to cover some general aspects of ultrastructure, general aspects of the cell, that is, and then talk about some organ systems, and I've picked out ones that I think we deal with most often, that you're most likely to see in an EM photomicrograph. And that will be the first part. And then the second part, I've gone into some infectious agents to include viruses, bacteria, protozoa. I know that Dr. Doobie talked earlier in the week. Hopefully he's covered a lot of that, but I may be going over that again. And then finally neoplasms, which I think are very, EM is very, very useful in a diagnostic sense with neoplasms. The first thing I want to talk about a little bit is how to describe, and let me see if I can get the first slide on here. Is the projector on? Wait a sec while the projector goes on. Okay, that's my slide there. We don't need any more of that. I'm not getting a forward here. Am I on the right? Okay, there I am. Okay, one thing that I've noticed in training pathologists years ago is that people who are very, very adept at describing a case at the light microscopic level seem to run into a major stumbling block when someone puts an EM photomic in front of them. The description of an EM photomic is very similar to what you would be doing with a light microscopic case, with a few exceptions. First of all, you want to state the tissue, and therein lies part of the problem. You have to know what normal is. You have to be somewhat well-versed in distinguishing an epithelial cell from the intestine, from one in the renal tubules, for example, a neural cell from a neuroendocrine cell, for example. So the first thing you want to do is to state the tissue in your description. And then the next thing you want to do, which is a little bit different from what you do with a light microscopic case, is to present a brief description of what's there. Okay? I'm going to try, as I go through here, to give you landmarks on a lot of these photomics. And you can see exactly what I'm talking about. You've got to let that grader know. Now I'm talking about the ACV board exam. You've got to let them know that you know what's present there, and I'm talking about normal landmarks. And then you go into the pathologic changes. And once again, it's going to be very important that you be able to recognize normal in order to be able to pick up the abnormal tissue, and then you need to be able to interpret that. Okay? Next slide. Okay, your morphologic diagnosis is essentially the same as for light microscopy. I say keep it simple. You don't want to be going through every single change in the cell, i.e. Ballooning of mitochondria and the endoplasmic reticulum and rupture of the nuclear membrane, cell degeneration, cell necrosis. Your description will describe the rest. This is a terrible example right here. Hopefully I'll give you better ones as we go through here. Okay, getting into the general aspects of the cell, the first thing I want to cover are cell attachments. There are numerous ways that cells attach to one another. This is a schematic of intestinal epithelial cells as seen by the long, regular microvilli here. Cells have a junctional complex at their luminal border here, and we'll see a better photomic of that in just a minute. And the purpose of that is to keep the contents of the lumen from seeping in between the cells here. In a setting like the aciner portion of the pancreas, the exocrine portion of the pancreas, if you got some of those enzymes leaking in here, it would destroy the cells, no doubt about it. So the junctional complex I will describe in just a minute, and part of that is the belt desmosome, or the zonula adherens, which is basically a desmosome that girdles the cell all the way around, right underneath let me get to that in just a minute. Also throughout the cell, between the cells, you have spot desmosomes, which just anchor the cells at certain points. You have gap junctions, which contain connexons and are important in intercellular communication. And then finally, you have these little hemidesmosomes, which are desmosomes that insert into something like the basal lamina down here. Okay, here's a photomic of that junctional complex I was telling you about. The microvilli are up here. Right underneath that is an occluding junction called a zonula occludens. And this is almost like a Ziploc type junction, almost a fusion of the membranes here. Then there's a slight expansion or a clear space there, and that's called an intermediate junction. Let's look at the blow-up over here. And then you have a very well-developed desmosome here, which is the belt desmosome. And this is the zonula adherens. This is also called the zonula occludens here. And then this would just be a spot desmosome down here. Another important thing to note here are these interdigitation of cell processes, lateral cell processes. Very important in keeping cells together, and not just in epithelial tissue either. We see it also in a lot of nervous tissues, as we'll see in some of the neoplasms later on. Okay, now desmosomes are more or less characteristic of epithelial tissues, but not exclusively so. You see it once again sometimes in neural tissues, and I'm here to tell you that you also see it in non-neural, non-epithelial tissues. These are two macrophages which you can't identify by anything other than you may have a little lysosome there. And these were in a granuloma in a fathead minnow in the peritoneal cavity, in the body cavity rather. And these cells were loaded with Mycobacterium fortuitum, and I'll show you some of that a little bit later on. And this has been described before in an old VetPath article. That's why we look closely at these cells. These are nicely developed desmosomes. These cells were positive for cytokeratin. And these are microfilaments here, actin filaments inserting into the desmosomes there. It's very nicely seen there. This might be a red blood cell up here. As you remember, fish red blood cells are nucleated. It may have been phagocytosed by that macrophage. Okay, the nucleus of cells contains clear space, which is heterochromatin. That's chromatin that's being transcribed, translated, whatever. It has electron-dense clumps of did I call this hetero? This is euchromatin here. The dense clumps are heterochromatin, and very often it will be marginated around the edge of the cell, and in between these margins we'll find the nuclear pore, which I'll show you in just a minute. Also, sometimes centrally, but you also have to look along the margin, is a nice nucleolus, which I'll go into also in just a minute. The nucleus is delimited by a double membrane with an inner cistern. This clear space in here is a cistern. It has two lamina. The outer lamina communicates with the rough endoplasmic reticulum, and here you can see this number 7 are little ribosomes that are studded along the outer membrane of the nucleus. And this is a tangential section of the nuclear membrane, which shows the nuclear pores cutting cross-section. Once in a while, you'll see that in a photomic. Don't let it fool you into thinking that it's a virus or something like that. Okay, the nucleolus consists of 3 portions. The F is the fibrillar portion, which is nucleic acid. There's the focus. Okay, well, that may be the best. G is a granular portion, which is ribosomal, and the electron-dense portion is the pars amorpha, and I'm assuming that that's heterochromatin. Okay, Mitochondria are delimited by a double membrane. It's important to know that, because when these things are adversely affected, they tend to swell. Sometimes they will shrink. And one way that you may be able to identify it is that it has a double membrane. It has numerous cristae, which in this case are more or less lamellar. They zigzag back and forth across the mitochondrion. And I'll show you a higher magnification of that in a minute. And also has little granules in it. These are matrix granules, and they tend to be sites of where calcium aggregates. In disease, these will grow and become very electron dense and sort of irregular shaped, and we'll see one of those later on too. Here's a higher magnification of a mitochondrion showing the cristae here and the double membranes up here. I hope you can see that. This material in between here is the matrix. Okay, now in different cells, you have different configurations of mitochondria. In muscle cells, there are very plush, numerous mitochondria, very plush, numerous cristae, and the matrix is scant. Conversely, in hepatocytes, you have abundant matrix and very scant cristae. And to confuse things even more, but actually to help us in the long run, in the adrenal cortex, we have yet another twist on the morphologic character of mitochondria, and that's that you have these vesicular cristae very often. I'm talking about in the cortex, all three zones, or tubular, and occasionally lamellar, like this. Okay? And this is not 100% the case, but this is a general rule, and it's well worth remembering. In cases where you have a tumor in the neighborhood of the adrenal gland, and you get a nice biopsy sample of it, this could be very helpful in your diagnosis. Okay, now you do get some aberrant forms of mitochondria. This is one from a calf that was poisoned by oil-filled solvents. We're not really sure what. And here you can see mitochondria that are twisted in all different shapes, but the unusual feature here are these holes in there. And I know that they're holes because if you look closely, you may not be able to see it at the back. There's a double membrane surrounding these electron-lucent areas. And this one here is a little concentric lamination of membrane called a myelinoid figure, myelin figure, something like that. And that is just a little bit of membrane that's being degraded that is rolled up into its natural configuration. Okay, also in here I want to point out some smooth endoplasmic reticulum, and down here is rough, and I'll get into that directly. The rough endoplasmic reticulum in the cell is usually arranged in profiles, we call them. They're profiles of endoplasmic reticulum, and these profiles with rough are usually parallel to one another. The inner zone is clear, electron-lucent that is, and the outside of the membranes are studded with ribosomes, and that's in a healthy cell. Okay, quite the opposite to that. The smooth endoplasmic reticulum has no ribosomes on it. It's very often in a tangle like this, and sometimes it's very hard to see. You have to look in between other organelle. This cell happened to be from a hepatocyte of an animal that was treated with phenobarb. So this, a lot of the mixed function oxidases were induced, and therefore we get very, very abundant SER. And the other thing I wanted to point out here, this is a hepatocyte from it's a mitochondrion from an hepatocyte, and look how few cristae there are in this cell here. Okay, the Golgi apparatus has a definite orientation to it. Vacuoles are budded off of a transitional part of the endoplasmic reticulum and fuse with this forming or cis face of the Golgi here. They go through their processing in the Golgi and are budded off the trans or concave face, or forming face it's also called. And very often you'll get coated granules, which will go up, clathrin-coated, things like that, which will go up to the plasma membrane, fuse, and the contents will be released. I don't have any, none of these are coated granules here, and I don't have any photo mic of that, but that's the way the Golgi looks. Okay, and this is also from an hepatocyte. these little structures marked G here are beta rosettes of, alpha rosettes of glycogen, which are made up of little tiny beta particles, which you may see here. Now, beta particles can be very easily mistaken for ribosomes. They're about the same size, but in my experience, they're a little bit more electron dense, and they just tend to stand out a little bit more, a little bit better. Otherwise, it can be very confusing. Oh, one thing I wanted to show again. This is a lysosome up here. Membrane-bound, electron-dense, very common in cells like macrophages, for example. Okay, microtubules are very common in movement of things within cells, movement of cells themselves, as we'll see in just a minute. This happens to be a neoplastic cell, and here are these little fine microtubules here with parallel walls are part of a mitotic spindle, and these are the chromosomes up here. This is in a malignant melanoma. That's just an example of microtubule there. We'll see some more of them in just a minute. An abnormal filament, amyloid, has a diameter, or a width, I guess you'd say, from 7 to 10 nanometers, and is basically just arranged in a helter-skelter manner. It's very fine, almost looks like fine hair laying on the floor of a barber's shop. That's the way I think of it anyhow sometimes. You look for it in the kidney and other places like that. Actin filaments. These are microvilli which have been freeze fractured. This is a scanning electron photomicrograph. The microvilli are up here, and this is the plasma membrane right here. The actin filaments insert at the top and are attached along the side and stick down into the cell itself, into the terminal web. The terminal web is composed of actin and myosin. It inserts into the bell desmosome, and through contraction can open and close those tight junctions that I showed you earlier, and thereby increase or decrease vectoral transport of various materials from the lumen to the intercellular fluid, or vice versa. Also anchoring into this terminal web are the intermediate filaments, cytokeratin, vimentin, et cetera, that are so important in anchoring the cell, or keeping the cell rigid and keeping the shape proper. The microvilli are dynamic in that they can elongate and they can shorten based on the physiologic demands of the cell. And here's a transmission photomic of the same thing. Actin filaments, parallel sheaves of actin filaments inserting down here, and the terminal web would be down in here someplace. And a cross-section of a microvillus, just so that you know, because we're going to look at cilia in just a minute. There's an outer plasma membrane, and then there are these little tiny dots, which are the cross-sections of actin. And contrasting that, I hope people in the back can see this lower diagram. I'll show you the top one first. Cilia and Flagella are composed of microtubules. And there are outer microtubules and inner microtubules. The outer ones, since there are two here hooked together, are called doublets. The inner ones, since they're not hooked, are called singlets. In a cilium and a flagellum, above the surface of the cell, you have 9 outer doublets and 2 inner singlets. The outer doublets are hooked to a sheath around the singlets here by a spoke. They're hooked to one another by necks and links. And then if you look down at this diagram, they have little hook-like processes, dynein arms, which come out and are very important in the movement of these microtubules sliding up and down to make the cilia beat. Now this top cilium here is an example of a Cartegener syndrome or Cardiganer syndrome, however you want to pronounce that. You can see a dynein arm here. You can barely see one here. But basically, the dynein arms are missing from this. And so the cilia do not function. And you can just roughly go through the body of an animal and pick out where you would expect to find cilia, and that's where your defects are going to be. You have infertility because the spermatozoa are not motile. You do not have cilia to push ova down in the oviducts. And what else? Upper respiratory infections from the larynx down to the certain level in the bronchioles. You have no ciliary action to get microbes out. And then the final thing is situs inversus. All of the abdominal organs, and I think also the thoracic as well, are reversed. And so there must be something that comes into play in embryogenesis whereby cilia are important. Cartegener syndrome, you need a real good photomic to pick that out. I don't think they give you that on the boards. Something to keep in mind. Okay, the cilia insert into the cell in structures called, or they continue into the cell and end in structures called basal bodies or blepharoplasts. Now the structure of those is a little bit different, but is very similar to that of centrioles. It's not super important, but rather than having 9 outer doublets, they have 9 outer triplets, and there are no singlets in the center. That's the same way, basically, that a centriole is formed. Okay, and here's one aberration, a little bit dark here, but this is called a compound cilia, or these are compound cilia here. Numerous cilia ensheathed in one plasma membrane, rather. And here are regular cilia there. Okay, collagen. Normal collagen has a spacing of 64 nanometers. You're not going to be able to measure that unless you're on a scope and you have facilities to do that. So therefore, you have to become somewhat familiar with what it looks like in a normal photomic. Longitudinal section, cross-section of normal spacing collagen, 64 nanometer collagen. In a lot of neural tissue, especially in tumors, can be helpful diagnostically. You have what's called long spacing collagen. That is over 64 nanometers. And here you can compare long spacing collagen with normal collagen and see that there's a difference. You can't see the periodicity in the normal collagen, but you can tell that something probably is there. And this happens to be from a schwannoma. This probably is the nucleus here of a schwannoma. And these bundles here are called Lewis bodies. I don't know that I've heard that term in veterinary pathology, but just know that there is such a thing as long spacing collagen, sometimes seen in neural tumors, granular cell tumors, things like that. Okay, this is fibrin, just to show you that it also occurs in bundles, also has periodicity, if you can see at the bottom here. It's only 23 nanometers, so in most cases, you're not going to be able to see it. You're not going to be able to see the periodicity, that is. The extracellular matrix is composed basically of 3 different things. Here we have our collagen fibrils rather, and longitudinal section, cross section. This is elastin in here. It kind of varies from being electron dense to electron lucent in a large sort of oblong bundle. And these little spots here are proteoglycan. Okay, and just to remind you, I'm going to talk about basal lamina very quickly. Down at the bottom here is the way we normally see a basement membrane by transmission EM looks like a line on which epithelial cells sit. You have to remember that it's a sheet. It's like a drop cloth elaborated by epithelial cells on which they rest, to which they're anchored, by the way. And they usually sit, almost always sits on a bed of collagen. Okay? Different types of basal lamina, we'll see some that are fenestrated a little later on when we get into glomerulus. Okay, pigments in the cell. This is from a splenic sinusoidal cell. This is hemosiderin here. This is ferritin here. But one that's a little more easy to pick out is lipofuscin, which before it matures consists of a lot of little fatty vacuoles like this. And then as it becomes aged, if you will, becomes inspissated, very few fatty vacuoles, becomes a very electron dense, almost homogeneous. And in between you can get a lot of membranous material, which is flocculent, granular, that type thing. We'll see another example of that when we get to the adrenal cortex, a little bit better example of lipofuscin. Okay, now to get into some ultrastructural evidence of cell injury, I want to start first with the normal cell. Okay, you can see at the basilar portion of the cell that is very tightly adhered to its basal lamina here. At the apical portion of the cell, we have nice microvilli here, and here's one cilium there with this little basal body. There's a nice round nucleus with plenty of heterochromatin and a central nucleolus, very thin nuclear envelope. Endoplasmic reticulum is also thin, and take a look at the mitochondria here and just to get an idea of what normal size and shape are. When the cell is insulted slightly, the first thing you're going to see is a slight distension or dilatation of the endoplasmic reticulum. And by the fact that it communicates with the nuclear envelope, you're also getting a slight blebbing or ballooning of the nuclear envelope as well. But all the other features of the cell are fairly normal. So that would be a very early stage. A transmission electron photomicrograph of that change. Here you have swelling of the nuclear envelope here, and almost diffusely here, the endoplasmic reticulum, and I can't tell whether it's rough or smooth, from this magnification is dilated. Mitochondria are fine. If you saw a higher magnification of that, what you might see if it's rough endoplasmic reticulum is that ribosomes, and here they're still attached, but generally speaking the ribosomes have been shed off of the endoplasmic reticulum. And so you'll get a cytoplasm at higher magnification that's just dotted with ribosomes. Could be confused a little bit with glycogen, I suppose. Okay, then insulting the cell or damaging the cell even further, we see, first of all, at the basilar portion, the cell is becoming detached ever so slightly at that end. Going over to the apical end, we've now lost all of our microvilli, and the cilium is gone. The mitochondria are now beginning to swell. They're mildly to moderately swollen because of distension of the cristae by clear space, swelling. And by doing so, or in doing so, they've compacted the matrix here, so the matrix is more electron dense. You don't need to describe all this for the boards. I'm just describing it for you. And also, there's increased amplitude of swelling of your endoplasmic reticulum here. And there may be some dissolution of heterochromatin here. And that's about it with that. Insulting the cell even further, now we have gone from a sort of a first stage of mitochondrial swelling to a high amplitude swelling. And here we begin to see lysis of cristae, dissolution of cristae, and it's a process called crystallysis. And that is an irreversible change in the mitochondria. Here the cell is becoming detached almost entirely along its basal border, and we're beginning to lose almost completely the heterochromatin, and the nucleolus is beginning to fade out. Okay, and once again, maybe a little bit of increased amplitude of swelling of the ER. Now we're getting some swelling of the Golgi. All these membranous structures with cisterns are beginning to swell. Okay, here is what I was showing you in the last slide, where you have a high amplitude swelling of mitochondria. The cristae are being retracted to some degree. They're breaking up and becoming lyse. And here is the kiss of death for a mitochondrion, a rupture of the bilaminar membrane. And these vesicles are endoplasmic reticulum, which are ballooned up. And then finally, in the necrotic cell, you may see a pycnotic nucleus, you may see a rectic nucleus, and here you can just see that there's lysis of the nuclear membrane. The heterochromatin is gone, as is the nucleolus. The mitochondria are swollen. You have these very dense matrix granules, as I guess I better say first that if you look at the plasma membrane has been ruptured all the way along here. And so you're getting a massive influx of calcium, which is basically precipitating out on these matrix granules.
Dr. Fritz?
Yes?
That previous mitochondria, were those flocculent densities?
Well, they weren't flocculent.
Were those kind of
these would be more like normal right here, okay? And so these are beginning to grow. Okay, now going into the first organ system, the liver. The liver is a polygonal cell, usually has a central nucleus, central nucleolus, is surrounded by perinuclear rough endoplasmic reticulum. There are mitochondria in here, lots of smooth endoplasmic reticulum, which you don't normally see in a normal cell. I mean, you have to look closely to see it in a normal cell. And many other organelle in here. One thing that people don't realize is that there are numerous microvilli on hepatocytes. And they occur along the basal border here, and they protrude into the space of Dessay, which I'll get into in just a minute, and also have these little biocanaliculi between hepatocytes, hepatocyte here, 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 and here. And they also have microvilli, and I'll show you one of those in a minute. The sinusoids are lined by endothelial-like cells. Here they're called littoral cells. They're also lined by Kuffer cells, and I'll show you one of each of those in a minute. And they rest, rather than resting on or being affixed to a true basement membrane or affixed to a reticulin network, and thereby they form the space of Dissay here. It's important, I think, for people to get an idea of what a normal space looks like, because we'll see an example here. You can have slight swelling, and you need to be able to interpret that. You need to be able to recognize it and interpret it. Okay, an EM photomic of the things I just showed you, so I'll go through here quickly. Rough endoplasmic reticulum is here. There's the nucleus there, a little portion of it right there, mitochondria, and here's that smooth endoplasmic reticulum in here. This is a normal amount, a normal cell, okay? And there's a biocanalicculus right there, which you can just barely see, and I'll show you a better example right here, okay? Biocanalicculus has nice junctional complexes here, okay? And also you have desmosomes scattered between the cells. Nice mitochondria here, and these little dots here are glycogen. Now, this is a special preparation, so the glycogen really stands out in this. And here they look a bit bigger than the ribosomes. I'm not really sure if this has been altered a little bit or what. But anyhow, okay, looking at the sinusoidal space is right in here, lined by an endothelial-like cell, and the process is thin, just like a regular endothelial cell, goes all the way around here, and the space of Dissay is down here. I'll show you a better photograph of that in a minute. But you can see that you can't really see that much space because of the microvilli protruding into the space of Dissay. That's about it on that one. Okay, now this shows the little reticulin fibers here that you stain for with your silver stains to see whether it's intact or not, and when you have massive damage in the liver. And so this would be the cell process of the endothelial cells, reticulin, and microvilli of the hepatocyte. And these are alpha rosettes of glycogen up here. Okay, and here's the Kuffer cell. Characteristically triangular shape. It's not going to always look that way. I mean, if it's ingested particles, bacteria, and things like that, it's going to be massive. And otherwise, you may get a different section of it. It may look relatively flat. But once again, it has very thin processes. And is basically a fixed macrophage within the sinusoidal liver. Now, this is from a snow leopard, which is from a VetPath article. The sinusoid is out here, okay? The hepatocytes are here and here. You can see a few microvilli along here. So basically what we have here is a tremendous expansion of the space of Dissay, mostly by clear space, which would be edema to me. There are fibers in here, and I know from reading the caption on this that they are composed of collagen and fibrin, and you'd almost need a higher magnification to be able to say that yourselves. There are also red blood cells in here, and also along these hepatocellular borders, there are skip areas where microvilli have been lost, and those are things that you would want to describe in a case like this. There's also supposed to be an Edo cell in here, and I'm thinking it's right here. This is a cell that I don't know a whole bunch about. I do know that when they proliferate, very often they can look like fat cells. And that's all I'll say about that. Okay, now here's another case of a dog that was on long-term corticosteroid therapy. Let's see if I can. And basically what you have is glycogen degeneration of the cell. These hepatocytes are tremendously swollen because they're stuffed with glycogen. You can't really tell that it's glycogen from here, but you're going to have to make that interpretation, I think, in a board slide, because you've got to ask yourself, what's the most likely thing it could be? And also notice that because there's so much glycogen here, it's beginning to partition a lot of the residual organelle in here. Your mitochondria in here, your rough endoplasmic reticulum is over here, although you can't really recognize it. And this is the type thing well, I'll show you a better case in just a minute. These are the type things you want to describe in your photomics. Okay, here's a dog that was being treated with primidone, an epileptic dog. Massive reduplication, if you will, of smooth endoplasmic reticulum to the extent that the residual organelle, mitochondria in here, a little bit of smooth endoplasmic reticulum here, probably some lysosomes and things like that, are either peripheralized, they're pushed out to the limit of the cell out there or being shoved in next to the nucleus there. And also, there are probably maybe a little bit of dissolution of heterochromatin in there. The nucleus looks a little bit swollen to me. Okay, this isn't a great slide, but this is from an old AFIP Wednesday slide conference case, Bedlington Terrier. These are hepatocytes with lysosomes filled with copper. I just wanted to show you some lesions in the liver, and there's one. Okay, and this is from a case that I had in Alberta. It was a calf that was poisoned by, no, I'm sorry. This is from a cow that got into diethylene glycol, which is a hydroscopic agent used in processing of natural gas. And these cattle will get in and eat almost anything, methanol, diethylene glycol. And so this is just diffuse, marked, or moderate swelling of endoplasmic reticulum. And also the nuclei here don't look too good. The nucleolus is gone. It's a lot of, I don't know, it almost looks like a pycnotic, or becoming a pycnotic nucleus there. Believe it or not, the kidney looked 10 times worse. Okay, gastrointestinal. We start with the stomach. The parietal cell is a somewhat unusual cell in that it has these deep, it's basically, number one, a triangular shaped cell, has these deep invaginations into the cell called secretory canaliculi. They're lined by very plush microvilli. It also has abundant mitochondria, which gives it that eosinophilic hue or color by light microscope. Has these dense bodies here which contain the HCl, hydrogen chloride. And to see a real photomic of that, we see the basilar portion down here resting on a basal lamina, the apical portion here with a little lumen there, and these are these deep canaliculi here, okay? And the chief cell looks very much like some other cells we're going to see in just a minute. It has abundant profiles of rough endoplasmic reticulum seen here, and it has zymogen granules here, which are more apically located in the cell. Also, we have mucous neck cells in the stomach, and they're not very interesting. They have, with certain stains, they show up as very electron-dense mucus globules. Okay, getting into the intestines, as you know, the intestines have numerous microvilli, which are very often finger-like or rounded. These are flat and tongue-like from the ileum of a rabbit. And in one area, I found an artifactual fracture, which I thought was interesting because you can see the epithelial cells lined up here like barrel staves, resting on the sheet of basal lamina here. And this is the lamina propria in here with your lymphocytes and plasma cells, and these clear areas here are capillaries there. A little different view of a, oops, that's a terrible photograph, but I wanted to show it because these are how villi often look, very finger-like, and this is villus atrophy and TGE of a pig. This is not severe villus atrophy. This I would call marked or moderate. And you can see some of these little double humps in here if you can make that out. And that's the fusion that you get with fusion of 2 or sometimes 3 microvilli. Of course, the atrophy here is, like I said, marked, and there may be probably also some blunting here as well. So that's what that looks like by scanning EM. Okay, the microvilli in the intestine are very regular in their height. And just to remind you here that there's a glycocalyx or a fuzz layer on there that's composed of enzymes which have the purpose of digesting materials in the lumen of the intestine. Also, they have a specific charge on them, which generally tends to repel unwanted materials and attract wanted materials. This is a special preparation of fixation and later processing, which shows these actin filaments inserting down into the cytoplasm itself. And down here, they're called rootlets. Now, this is a small intestinal cell, and in normal preparations of small intestine, you tend not to see this rootlet here. And the reason that's important, I'll show you in just a minute. Also over here on the lateral borders, you see some of these interdigitations of the cell processes of this in this cell here, and the occluding junction is up here. Okay, just to show you a goblet cell here in the high and the small intestine. In the small intestine, your microvilli are longest up high, like in the duodenum and the proximal jejunum. And as you get down to the terminal parts of the ileum, they become much shorter, and when you get into the colon, they're fairly stubby, but they're always very regular in their height. Okay, that's mucus. And when you take a mucus cell and expose it to something like acetylcholine or the animal to acetylcholine, where you get release of mucus globules, if you will, you get this excavitation of the cell here. So if you see a photomike with excavitation of mucus cells, you might interpret that to mean that there's been some injury and the mucus has been secreted to protect the surface of the lumen. Okay, in some animals, like I think primates and rodents as well, we get Paneth cells, which are very similar to the chief cell I showed you in the stomach, in that they have abundant rough ER and these dense secretory granules here. Paneth cell. Okay, now we're in the colon. This is a normal colon up here, and this is a colon from a colonic, it's an adenocarcinoma colonic type from a human. Just to show you that very often in the colon, the rootlets of the microvilli are very dense. They're very easy to see. And this was, in one of the courses I took, was brought out as a diagnostic feature and could impact somehow on the prognosis of the animal. These little dots here are called glycocalyceal bodies, and as far as I can tell, the significance is not known. They're seen in both healthy and diseased animals, but not too often in my experience have I seen those things. Okay, now we're in the exocrine pancreas. Once again, just like the chief cell, just like the Paneth cell, we have abundant rough endoplasmic reticulum here and zymogen granules apically, and the little lumen is down here. And what this doesn't show is that these cells also have microvilli. They're stubby and irregular. They're not at all like what you see in the intestine. Okay, and this is an exocrine pancreatic cell that was, the animal was treated with puromycin, just to show you a change here. And you can see that the cell is swollen, it's bulging in, if this is the lumen down here, which I'm not sure about. It's bulging into the lumen, and the swelling is due to this diffuse dilatation of endoplasmic reticulum, probably rough because there's so much of it in these cells. And here you have these massive lysosome-like structures which are degrading. Looks like mitochondria and things like that. And there are very few of the secretory zymogen granules in here. These may be some up here, but they don't have the same consistency as the normal ones. So all those things might be things you'd want to describe. I'm going to get to the islets a little later, okay? Getting into the urinary, which is very important for diagnostic purposes, that you know a little something about it and how to describe it, because it's an excellent case to put on a board exam, for example. The glomerulus is the one I want to hit the hardest, the area I want to hit the hardest, and it is composed of a tangle of capillaries, the capillary loop. The capillaries themselves are composed of a lumen. The lumen is lined by an endothelial cell, which you see here is highly fenestrated. It rests on a basement membrane, very thin, and here again, this is something that you want to get a feel for in looking through books, looking through journal articles and things like that, so that you can recognize when and where it's thickened. Okay? Now, external to the capillary loop are these visceral epithelial cells or podocytes, which have little foot processes which sit on the exterior portion of the capillary. And in between the foot processes, there are filtration pores in health. And that's what you want to look at very closely in photomics to determine whether the foot processes are there, whether they're fused, or what. Also note in the center of this glomerular tuft is the mesangial matrix with the mesangial cell, and that the mesangial cell in this case is not doing anything. It's very quiescent. That's the message I want to leave with that right there. Okay. Let me go on to the next one. Now, here's a photomike of the same thing. The lumen of the capillary, red blood cells, endothelial cell nucleus, and the cytoplasm is all the way around here. The podocyte is out here with its little foot processes studded all the way along the membrane here, and all this out here is urinary space. Okay, and there's the mesangial cell right there. Okay. Now, just to orient you on this is a higher mag of the glomerular basement membrane. There's the capillary lumen. Endothelial cell is right there. The glomerular basement membrane is made up of, has three different layers. The inner layer is the lamina densa because it's more electron dense, and the two outer ones are lamina rara. lamina rara externa, lamina rara interna. Okay? For descriptive purposes for the boards, I don't think you really need to know it in that detail. These are the podocyte foot processes here and the little filtration pores there. And then the cytoplasm of the podocyte right there. Okay, and here's what I want to concentrate on this bottom scanner down here, photomic down here. This just shows the profile of a capillary here and the cell body of a podocyte, and you can see the branching and arborizing of all these little podocyte foot processes that sit and cover the outside of the capillary in health, in good health, that is. Okay, now, just to give you several examples of where EM can be very helpful in diagnosis of glomerular disease, I want to present first membranous glomerulonephritis. In membranous glomerulonephritis, there are dense deposits which are subepithelial and are not in the basal lamina, which is right here. This is a blow-up of this area right in here. The most important thing, other than the dense deposits in here, to see is that there's complete fusion, in this case anyhow, of the foot processes of these podocytes. Okay? Also note that there's no change in the mesangial cell. To see a photomic of that, we can see these individualized deposits along here. Note that the basal lamina is intact all the way along here. To back up a little bit, here's the capillary lumen here, and the endothelial cell goes right along here. The podocyte is up here, and notice that there's complete fusion of foot processes here and over here. Sometimes in this disease, you will get eventually reduplication or elaboration of more basement membrane material, which will stick up between these deposits and give you nice spikes, which you can see with a silver stain, your PAS and silver stains by light microscopy. Okay, the next lesion I want to show you is membranoproliferative glomerulonephritis. And in this case, you can either get, I don't think it's really important where the deposit is so much, it can either be subendothelial here, or it can be intramembranous, right in the membrane. The important thing is here that you only get a few skip areas, where you only get a few areas, where you have fusion of the podocyte cell processes. That's not really so much of a feature of this disease. What is a feature is that for whatever reason, these mesangial cells have proliferated, and not only that, they are interposing their cell processes into this basement membrane or matrix material here. And so when you do a silver stain or or PAS by light, you tend to see a splitting of the basal lamina. To show you an EM of this is very hard to get oriented on, but here's the podocyte out here, and notice that the foot processes are pretty uniform, and the basal lamina is out here. There are two very dense, very large deposits here that are actually in the matrix of beneath the basal lamina here, but they're also subendothelial because there's the endothelial cell right there, and we can't see the capillary lumen right here. We don't see mesangial cell processes in this one. That's why I could have gotten, I guess, a better photomic. But here is another case. This is not a diseased glomerulus, but these are mesangial cells right here. And these are their little foot processes, not foot processes, but processes that are scooting out towards the basement membrane. You have to remember that even in health, some mesangial cells have processes that stick either underneath the endothelial cell or somehow out into the lumen of the capillary. And I think of it as they're tasting the milieu. They want to see what's going on in there and whether they should react or exactly what. And that would be in health. Okay, getting down into the tubules, remember that the proximal tubules are taller columnar, taller cuboidal cells. They have a very plush brush border. Here's the basal lamina down here, and the capillary would be down in here. Let me show you a little higher magnification of that. A very plush brush border here, microvilli that is. They have a very well-developed endocytotic apparatus, so all these little blebs here are going out of the cell. And another thing that's characteristic about tubular epithelial cells is that they have mitochondria that are oriented, they're very elongate, number one, but they're oriented perpendicular to the basal lamina. Further down the nephron, the distal tubular cells are similar, except they're lower cells, lower cuboidal. They, once again, have long mitochondria and much shorter in the way of their brush border. And there's a capillary over there, okay, with red cells in it and an endothelial cell lining it. I think, whoa. Oh, okay. Thank you. Okay, and then finally, I think finally in the kidney, in the normal kidney, we have juxtaglomerular cells, which are modified smooth muscle cells, and because of that, you can see, not in this photo, Mike, but numerous intracytoplasmic filaments, and they also have secretory granules here. These cells respond to a falling of the blood pressure, I think a falling also of plasma sodium or something like that, and their granules contain renin. These are Highland Droplets in a rat tubule. I wanted to show you that. That's from an old Wednesday slide conference case. I don't have a whole lot on kidney tubules here. And these are lead inclusions in the nucleus of tubular epithelial cells. Notice the lead inclusion here to be distinguished from the nucleolus over here, okay? And there are also other changes in, I think the nucleus is swollen here to some degree. It looks like the cytoplasm in general is rarefied, which usually means that it's somewhat swollen too. And this would be the lumen down here, where you get this tangle of microvilli. Respiratory tract, high up in the larynx, or actually in the airway itself, all the way down, you tend to have three types of cells. You have goblet cells, you have ciliated cells, and you have secretory cells. This is a scanner of the trachea, okay? Ciliated cells, this looks like something from the floor of the sea, a coral bed or something like that. But these are cilia right here, and they are very long, exactly what you'd expect. And then these little sea urchin-like things here, these are the stubby microvilli on the non-ciliated cells. And also in here, you would expect to see some goblet cells. Usually they're a little deeper, and what you may see is a blob of mucus coming out, and it basically has the character of that little speck right there. Remember that the ciliated cells have very prominent basal bodies. Usually right underneath the basal bodies is a large aggregation of mitochondria to power those basal bodies, and that also interspersed in between your cilia, you've got microvilli. Now you've got to be able to distinguish these things, because in disease you're going to begin to lose microvilli, you're going to be able to begin to lose cilia, and you've got to really have somewhat of a handle on that. Okay, and this is just to show a goblet cell here, ciliated cells as well. Okay, and then as we get down further into the airway and the bronchioles, we have a ciliated cell here, and then these non-ciliated secretory cells with secretory granules that are of a medium density, not real electron dense, not lucent, and they also bulge into the surface of into the lumen, and those are your Clara cells. This is down at the terminus of the bronchiole. Notice that there are no cilia here at all. There are a lot of bulging cells, which are the Clara cells, and you just get a feel that there are some cells with microvilli present here as well. These are all of the alveoli around here, which are artifactually collapsed. Okay, the alveolus is an airspace, and it is delimited by a septum with several holes in it, pores of con. And lining the septum predominantly are type 1 cells, which have very thin cytoplasmic processes which spread out along the basal lamina, and where their nucleus is, they bulge ever so slightly into the alveolus itself. Supporting the alveolar septum is the capillary, and here it is here, several red blood cells, a platelet here, and some interstitial collagen here as well. There are scattered fibroblasts, fibrocytes, mast cells within the septum here as well. Also studded along the septum are these type 2 cells, which have, well, very numerous microvilli, but they're kind of stubby and irregular looking. But the characteristic feature of these are these concentrically laminated whorls surrounded by a membrane, and these are the lamellar bodies, or sometimes called multilamellar bodies, and they contain surfactant. And when the surfactant is released, it sometimes will take on very strange configuration. And this is surfactant that's being released onto the surface of the alveolus. This is an alveolar macrophage. Remember that they look very similar to type 2 cells, except they don't have multi-lamellar bodies. They don't have microvilli either. They have pseudopodia like this, and this one is squeezing between into a pore of Kahn, in or out. I'm not sure which. The macrophage we'll see a little bit more of in a minute, if I can keep going on this. In disease, it can be very hard to tell what's going on in the lung, because you may have obliteration of the alveolus, with the alveolar sac, which you don't hear. But you can get such tremendous expansion of the septa that your landmarks are gone, they're hidden. Here's an alveolar lining cell, probably a type 2 cell, because I think I see some scroll-like material in there. But the septum is tremendously expanded by plasma cells, fewer lymphocytes, and a macrophage there. And this is in an allergic alveolitis in a human. Okay, this is a case from, I think, a fairly recent vet path in cattle that were experimentally poisoned with 3-methylindole. And this is basically type 2 hyperplasia at the EM level, at the ultrastructural level. These are type 2 cells, and they're studded along here. There are no type 1 cells that you can see in here at all. A capillary courses through here, and there is the neutrophil right there. We'll get to neutrophils in a little bit here. Also in that same study, here is septal edema in here. This is the capillary wall right here. Platelets. This is a macrophage, which you can't really tell, and the mitochondria are swollen, by the way. Now here is the process of a type 1 cell, and it is swollen right here. This is very hard to distinguish. I think that something on the boards would have to be a little bit more clear-cut than that. I mean, you would think that you're not supposed to be experts. But you want to pay close attention to photomics in journals like VetPath to be able to pick up things like that. Here's a Clara cell with dilatation, diffuse dilatation of the endoplasmic reticulum. Also note that most of the secretory granules are gone. And also another thing that was noted in that study were these subendothelial vesicles in the septal capillaries. I've seen that in some other studies as well. And here's a little bit of edema down here with a little collagen and whatever else. Okay, I'm going to have to run through the endocrine system, but the endocrine system is kind of fun, especially the neuroendocrine or APUD type cells, because you get good dense core granules. And a lot of times you can tell where you are just based on the morphology of the granules itself. Now we're in the islet of the pancreas. This is an alpha cell. Notice that there's an indentation of the nucleus, which is supposed to be characteristic. The dense core granules, there are many different sizes to them, but they're uniformly very electron dense. At a higher magnification, this isn't the photograph I really wanted, but I want to explain something here, that in describing a granule, you would first describe it as being a structure that's delimited by a membrane, which you can't see here. Usually there's a clear halo around it, which you can't see here, and then a dense core, which is the secretory material. And the density may vary, so you may want to call it of medium density, of high electron density, or granular, or whatever. Now the beta cells are more fun, because now here's the alpha cell up here. You can see that little halo around there in between the core and the membrane. But the beta cells often, not always, have pleomorphic granules. And you can see that there's a membrane, a clear space, and then you name it, and it's in there. But the thing that is diagnostic in a beta cell is a bar-shaped crystalloid granule. And I'll show you one of those in just a minute. If you have a tumor with one of those in it, according to experts, that's the only thing it can be. Alpha cell, beta cells here. This is tissue from a vole. It's normal pancreatic islet tissue. These are beta cells. You can notice the pleomorphic granules within their pleomorphic cores within their granules. Here's an alpha cell up here. These animals were given monosodium aspartate, I think, something like that, which made them mildly diabetic. Oh, here's that characteristic bar-shaped crystalline granule here of a beta cell. When you see that, that ices it. And here's a delta cell over here. Their granules tend to be a little bit more electron lucent. Now this is the slightly diabetic vole. Notice the paucity of granules. The granules are peripheralized. Most of them are round in this case. The abundant rough endoplasmic reticulum in here, and there's the well-developed profiles of Golgi there as well. So these cells basically are hyperfunctional, trying to get out as many granules as they can, and they're failing. Okay, very quickly going through the thyroid follicular cell. The lumen is out here. They have microvilli along here. I guess characteristic of the cells that they're numerous phagosomes, lysosomes, phagolysosomes, what have you, in there, and they're constantly transporting their colloid or what have you back and forth. I don't have a photograph of a parafollicular cell, C cell, but they do have some dense core granules, like you would see in an alpha cell, for example, in the pancreas. I will show you a neoplasm in a minute. Getting into the parathyroid, the chief cells can also have secretory granules, not true dense core granules. And when they're not that active, you tend to see a lot of lipid in them. This is lipid here, and also a lot of glycogen. Otherwise, they're fairly non-interesting. Oh, here's a, from very recent vet path. This is a chief cell from a mouse, I believe, in which was experimentally induced a hypercalcemia of malignancy. And it wasn't a malignancy of the parathyroid, but this inclusion here was seen in the chief cells, and I would describe this as a round, very electron-dense central body with an island of, looks like cytoplasm paracentrally, and then these concentric laminae surrounding it, maybe compressing the nucleus to some degree. Hyperfunctional, trying to get out as many granules as they can, and they're failing. Okay, very quickly going through the thyroid follicular cell. The lumen is out here. They have microvilli along here. I guess characteristic of the cells that they're numerous phagosomes, lysosomes, phagolysosomes, what have you, in there, and they're constantly transporting their colloid or what have you back and forth. I don't have a photograph of a parafollicular cell, C cell, but they do have some dense core granules, like you would see in an alpha cell, for example, in the pancreas. I will show you a neoplasm in a minute. Getting into the parathyroid, the chief cells can also have secretory granules, not true dense core granules. And when they're not that active, you tend to see a lot of lipid in them. This is lipid here, and also a lot of glycogen. Otherwise, they're fairly non-interesting. Oh, here's a, from very recent vet path. This is a chief cell from a mouse, I believe, in which was experimentally induced a hypercalcemia of malignancy. And it wasn't a malignancy of the parathyroid, but this inclusion here was seen in the chief cells, and I would describe this as a round, very electron-dense central body with an island of, looks like cytoplasm paracentrally, and then these concentric laminae surrounding it. Maybe compressing the nucleus to some degree. You can probably read about that in the last issue of VetPath. The oxaphil cells in the parathyroid are characterized as having numerous mitochondria in them, so they're going to be very eosinophilic as well. And then there's a chief cell over there. Okay, getting down also into another nice organ, the adrenal medulla. There are basically two types of secretions that come in those cells, and with the epinephrine secreting cells, you have your garden variety dense core granule here. It's a round electron dense granule, thin halo, and a membrane. With the norepinephrine, here's the epinephrine over here, thin halo. With the norepinephrine granule, you tend to have a larger clear space, a membrane of course, and the granule tends to be eccentric in there. Now here, it's not typical of what I've seen. It's more typical of this, and I'll show you a neoplasm later on where that's very evident. So you can tell between epinephrine and norepinephrine secreting cells if you look closely. Okay, also in the adrenal cortex, here once again are the mitochondria, which are characteristic, have vesicular and some tubular cristae in here. Also lots of lipid vacuoles and there's the lipofusin in there, which has a varying density and character of material within it, ranging from very electron dense to very lucent lipid granules in it. This is an adrenal cortical cell from an animal that was given a cationic amphiphilic compound. And basically what you have here are lysosomes that are filled with structures that are very similar to that chief cell I showed you just a minute ago. Very electron dense round center, and then these concentric laminae surrounding that. And this is an example of phospholipidosis in the adrenal cortex. And my thoughts are, if you had an animal with gentamicin toxicity, you would see the same type thing in the renal tubular cells. Okay, to run through blood cells, just so you know, the numerous granules within a polymorph, a PMN, and I won't go through all the granules here. We'll see a few of those in action in a little bit. Here's one in action. Here's one squeezing, diapodecing, or I don't know whether that's a proper term for a neutrophil. In between two endothelial cells, you can see their processes of retracted red cells up here, and it's going to slide out into the extracellular, to the pericapillary space. This is an eosinophil. Usually have a bilobe nucleus and fairly dense granules. We remember that in some species, cats, humans, rodents, they have a very distinct crystalline core, okay? And that's this. Otherwise, I imagine you look for granules which do not vary as much as the ones in neutrophils, and they have a bilobe nucleus. This is a normal eosinophil from a Brangus cow, and this is one with Chidiac-Higashi syndrome with these megagranules. Large granules, the proper term is a megagranule, as I understand it. A macrophage, this is described here as a microvillus. It's not truly a microvillus. It's a pseudopod. Thinner ones may be called philopodia, and sometimes you get little spikes coming off of some of these cells, and they call those microspikes. But I think for board purposes, call them pseudopodia or cell processes would probably be good enough. There are numerous lysosomes within a macrophage. The nucleus is, of course, reniform very often, and there's some Golgi there, and you can see mitochondria and a little bit of Ruffiar up there. Okay, and here's a monocyte from a fox with Chidiac-Higashi-like disease. I don't think my focusing is working here, but let's just move right along here. This is a lymphocyte. Notice that there's nothing interesting about this cell at all. There are couple of mitochondria here. There's a little bit of, there are some ribosomes in there, and other than that, it's very scant cytoplasm. The plasma cell is quite the opposite, though. It has very well-developed chromatin clumps around the edge, giving it that clock face look. Very plush, Ruffiar, and usually a well-developed Golgi apparatus there. Okay, a basophil is very much like a mast cell, except it is bilobed, or at least not unilobed. I'm not focusing this thing anyhow. But the granules are not uniform one to the other. You have some here that are dense, not dense, that are sort of granular looking, and some that are very uniform and dense. And I'll contrast that to a mast cell in just a minute. Platelet, remember, has no nucleus. It has alpha granules seen here, dense granules, which are not shown here, abundant tubular structures, and some little glycogen dots in here, which probably aren't that important. We'll see some more of them in a little bit. Here's a mast cell. The nucleus is usually central. The granules are, well, they look at this magnification to be homogeneous. At a higher magnification, sometimes they can be almost have a lattice within them. When the cells are exposed to concanavalin A, you get fusion of these granules and release a lot of the contents to the exterior. In humans, and also I think in guinea pigs and maybe some other species, you get these scroll-shaped granules. Okay? Cardiovascular. Very, very quickly, here's the cardio part. This is a sarcomere in the heart or in striated muscle, consisting of the A band here, the myosin and actin combined in here, the I band, which is electron lucent, and then your dense Z band right there, which is very helpful in diagnosing tumors. This is from a duckling exposed to furazolidin. And you notice that there's complete lysis of myofibrils in here. There's rarefaction, basically, and swelling of the sarcoplasm of the myofiber itself. The only thing remaining are these microvilli here, which are condensed. You can't really tell they're microvilli except for a few down here. And the reason this happens, it's thought, is if you look up here, if you had very sharp eyes, you get these little railroad track-like leptomeric complexes, and it's thought that the furazolidin attacks these, and these in a normal animal anchor the myofibril to the sarcolemma here. So you get essentially myofibrillar lysis when those leptomeric complexes are broken down. This is a myocardial cell from a pig exposed to T2 toxin. And this is a contraction band right in here, which is supposed to be hypercontraction of myofibers in dying cells. And here's an aggregate of mitochondria. Obviously, to me, there's been some attempt to regenerate their, not regenerate, but to get these things going again, get them functioning again while they were dying, while the cell was dying. Okay, and then finally, vitamin E selenium deficiency in a calf. There are a number of things in here to describe a lot of concentric laminae, vesicles, lysosomes, like down in here, cytosegrosome, with just a whole variety of electron-dense flocculent, amorphous, granular material. You can let your imagination go wild when you're describing these things. There are fragments of myofibrils in here, and there are some mitochondria here where you can see that there's been lysis of the cristae, and here there's been condensation of mitochondria. Okay, and then we've already pretty much been through the endothelial cells, but here's the large nucleus here. There's a junction between the processes of endothelial cells. These tend to slide apart when the animal is given histamine. For example, it rests on a basal lamina in here, and then there's a pericyte out here, and collagen in the adventitia. Okay, one thing I want to show you real quickly, these are called Weibel Palade bodies, or Weibel Palade bodies. They're much smaller than mitochondria. There's no scale on here. There should be. These can be helpful in diagnosing tumors. It's not known exactly what their function is. I heard one time they were thought to contain factor VIII-related antigen. They're kind of racket-shaped, or they look like the head of a racket or a lacrosse stick or something like that. Just remember that they exist, and if you have a tumor where it seems to be wanting to form a lumen and has these little unknown structures here, you might want to guess it's endothelial. Neural's very short, and then we'll take a break. This is a ganglion cell representing all neural cells, all neurons. The Nissl substance is made up of rough ER and ribosomes. Usually has a very prominent nucleus, or nucleolus rather, and mitochondria, as you can see here. These look kind of swollen, but they're not. It's the way the tissue is prepared. In an myelinated axon, you centrally have axoplasm, and your myelin laminae have a periodicity. In other words, they're evenly spaced. Now, this is abnormal in that you have abnormal compaction of these myelin lamellae in this dog. But I wanted to show you what normal looked like here. This is a cat treated with bromothalane, and here you see some splitting of these myelin lamellae. And in an advanced disease, you see that the lamellae have essentially been blown apart. I think that this is the axoplasm up here, and you see this tremendous vacuole where the one lamellum has been just scooted way out of the side. There's some more axons in here, and there's just splitting of the lamellae of myelin in all these. There's the nucleus of an oligodendroglial cell. This is an axon from a silver fox with a hereditary spongy degeneration, and this, I believe, was in the cord, spinal cord. Same type thing, splitting and tangling of myelin lamellae. This is monocytosis in a cat, a storage disease, finally. Membrane-bound, clear granules in this case. These were limbal intermediate cells in the brain. And then my final one here for the CNS is in the this is in a pyramidal neuron of a cat with sphingomyelin lipidosis, and these are called zebra bodies here. But just note that it's a membrane-bound structure with parallel array of laminae. Sometimes they're whorled in an oblong fashion. And I think if you can at least describe a lot of these things, even though you can't really pick it out from knowing exactly what it is, that you'd be well ahead of the game. Remember, description in the boards is worth a lot of points, and your morphologic diagnosis should fall right out of your description, and actually naming the cause or the disease is a couple points, really. At least that's the way it used to be. So let's take a break for maybe about 5 minutes, 10-minute break, and then we'll come back and we'll get into some different stuff here. Okay, I want to go now into infectious agents. The first part will be viruses. The reason I'm going into infectious agents is because they lend themselves most of them are too small to be examined well by a light microscope, and they lend themselves nicely for examination by electron microscopy, whether it be transmission or scanning, and also to some special techniques which I'll go through very briefly. This is just a very dark chart of viruses. The RNA viruses at the top, starting from the smallest picorna to the largest Rna virus. And over here in the DNA viruses, the parvo going up to the very large pox virus, which I'm convinced you ought to be able to see with a light microscope in some cases, because they get up to about 450 nanometers or so. I'll show you some of those too. Now, I don't want to just run through and show you viruses, and you're not going to see too much of the cell in these cases. It gets kind of boring. But what I do want to impart on you here is that it's very important to be able to distinguish viruses, some of the very small ones, from ribosomes. Like, here's a good example here. Picornavirus, which could be foot and mouth or something like that. And there are ribosomes, say maybe up in here, which are of similar size and may look similar in other regards, but you've got to be able to pick them out. And let me tell you, when you get an electron microscope and you spend 8 hours looking at stuff like this, you begin to see things. And when you're on the boards, after your 3.5 hours or so of sitting there writing the exam and sweating and doing everything else, you're also going to begin to see things. So you want to be able to develop some confidence, and that's what I want to show you here, just patterns. Now here, the viruses very nicely have formed themselves into a little crystalloid. There's another smaller one down there, a little aggregation there. And with some viruses, that's the type thing you see. Unfortunately, that's not all that you see. You don't always see that. This is blue tongue virus from a VetPath article. This is an endothelial cell up here. There's the nucleus right there. And this is an aggregate of virus-specific tubules, which are not specific to blue tongue virus, but in my experience are seen very often in virally infected cells. And I'll show you an AIDS cell in a few minutes that has that. But you see little dots interspersed in here, and those are some of the blue tongue viruses. These are virus-specific filaments in a similar cell, anyhow. And very nicely, the virus is lined up one after the other on that filament bundle there. This is also from a new VetPath. What I wanted to show you here was this. But first of all, this is the surface of a red blood cell 1 hour after infection of, I think it was a cow with blue tongue virus. And these virions, mature virions, are infecting, or at least causing an invagination here of the membrane. But this is, if you talk about using immune electron microscopy, this is immunogold here. Notice that these particles are of similar size, and they're hooked to an antibody which is against some specific antigen on the surface of the virus. And so this is the type thing that you would see by immune electron microscopy. Sometimes you can't see a virion at all. Sometimes you just see aggregates of this, which will tell you that portions of the virus before it's synthesized are present in a certain part of the cell. This is a negative stain. It's too dark here, but this is rotavirus. Okay, it could be from a fecal sample or something like that. This is from the ileum of a pig. These are absorptive cells here. Notice how they have nice, uniformly long microvilli, and these are M cells here. They have microvilli as well, but they're pretty badly formed. In the endoplasmic reticulum here are large aggregates of viruses, and you'd almost need a higher magnification to really convince yourself that that's what they are, but that's indeed what they are. And then here also, conveniently, is adenovirus in the nucleus here. The nucleus is expanded here, and there's some rarefaction of the nucleoplasm. This is also rotavirus rather, in a neonatal puppy. These are cisterns of endoplasmic reticulum, and these viruses are budding into the cistern, although I can't see one that's really convincingly budding here. And then these would be mitochondria here as well. Coronavirus, a negative stain once again. You're not going to see what I'm going to show you here in a true tissue preparation, but on negative stain, you notice these little electron-lucent dots around the periphery of this virion, and these are little petal-shaped structures called peplameres. They almost look like petals of a flower on the coronavirus. This is Eastern equine encephalitis, which is very dark once again. And these immature virions are palisading around profiles of endoplasmic reticulum, and then as they bud out of the cell, they become more mature. All you can see there is that they become a little bit larger. A lot of times they'll pick up membranous material from the host. Now this is a human lymphocyte infected with the AIDS virus. Anyhow, notice that it's not the simple cell that we saw a while back, that the nucleus is very pleomorphic. It's multi-lobed. This is also a tissue culture cell, and it's important to know that they're not always nice and neat like what you'd see in the body. Sometimes lymphocytes in culture will have nuclei that may have several lobes, but they don't look like this. This is also a tubular aggregate, virus-specific, presumably, tubular aggregate that are seen in some of these AIDS-infected cells and these large lipid vacuoles. So the cell basically is just very bizarre. Here's another lymphocyte. I call this a medusoid cell. You can't see the nucleus in this one, but these are all AIDS viruses around here on this cell. At high magnification, when a retrovirus buds off of when it is produced, let's say, you can't see it in the cytoplasm at all. There's no indication that there's AIDS in there at all. What you begin to see is a crescentric increase in density and thickness of the cell membrane. There's an outpouching here, and the next thing you know, you get a virion budding off. These are virions right here. Now, these are mature virions. Initially, what you get in an immature AIDS virus is a ring, an electron-dense ring around there. But you can see that these virions can be very difficult to tell from just regular cell process right here. So you need to look for some other features. And in this case, luckily, a lentivirus has a conical core. That's where its DNA material is. We don't see the cone here so well. We will in a minute. That's the type thing you want to see. Here's a scanning electron photomicrograph taken by Jean Bernard at Rare of a lymphocyte with three little budding soldiers, I call this. But these are AIDS viruses budding off the surface of a cell. Okay, now this is a enzootic nasal tumor in a goat. And we just get the feeling that it's a tumor by the monotonous cell population here. And higher magnification in the acini of these formed by these tumors, you can see little viral particles here. And if you could measure them and see that the little bar-shaped core in there would give you the idea that it's a lenti-like, not a lenti-like virus, a retro-like virus in this goat. This is murine leukemia virus in a megakaryocyte, and these are profiles of ER, cisterns of ER, and these are the mature virions here, and here's an aberrant one here. Simian immunodeficiency virus. There's just a lot of what I would term garbage going on in the cell. A lot of these myelinoid figures, a lot of cell destruction of organelle and things like that. Distension of endoplasmic reticulum, And within some of these ER cisternae are these little viruses here, all similar size pretty much. And when you see them at high magnification, there's that little conical core of the lentivirus. Okay, and here's a photograph from JAVMA a while back, and this was in the lung of a llama. And once again, you can see a lot of things here which are not convincing, I guess, right here. But these are the viruses here. Similar size. They have a little electron-dense ring in there. That's the immature particle there. And these may be budding viruses right there. Except in my experience, I'd want to see a little more dense ellipse right there. But anyhow, this is a retrovirus in a llama. Now, this is an orthomyxovirus. This is influenza in a, I can't remember the species. But anyhow, this is in the bronchus. And these are microvilli, which are somewhat distorted a little bit. Now, look at these cross-sections of microvilli and compare them to the virus. You can see how difficult it might be to tell these apart. But if you remember that you're going to have these little tiny dots, which are the cross-sections of actin in a microvillus, and here you've got something a little bit different. You've got the fuzz of the coat, and then this electron-dense ring, and you've got similar-sized particles in here. Then that gives you the idea that you're dealing with a virus. Okay, this is a transitional epithelial cell, I believe, from a dog. And here we have an aggregate of tubules in the cytoplasm. And this is canine distemper virus, paramyxovirus. And also there are some dots here. Uniform size should send off bells and whistles when you see that. This is adenovirus. It's not in this characteristic paracrystalline array, but you don't always see that with adenovirus. We'll see a nice one of those in a little bit. You see and here's a high magnification of this tubular complex, which would be the inclusion of this virus. Don't forget that you can also see the inclusion in the nucleus. It's an RNA virus, but it's thought that the nucleocapsid somehow can get trapped in the nucleus in there, and whether it ever completes its life cycle in there or not, I don't think has been fully determined. Respiratory syncytial virus in the lung of a young bovid, and this would be, I think, something like a type 2 cell where you have very poorly or abnormally formed microvilli, and once again, you have cross-sections of microvillus here and virus here. Let me see, there's one place down here where you can see it budding off. Okay, so it's a question of practice, and to some extent, it's a question of luck, too. Okay, bullet-shaped viruses are a little easier to see and tell. This is vesicular stomatitis in a negative stain. To see this same virus group in tissue, this is a hippocampal neuron from a fox, and there's this granular to lattice-shaped inclusion right here with tubular and sometimes round profiles of what appears to be a virus, or I guess you can interpret it to be a bullet-shaped virus. This is the Negri body, and this is the rhabdovirus of rabies. You also see it in the salivary gland, and this would be the cell surface of a mucinous gland in the salivary gland, and here once again are these bullet-shaped or tubular-shaped rhabdoviruses. Okay, here's a nice paracrystalline array of a adenovirus in the nucleus, two different inclusions here of a chameleon, another vet path, brief communications, and notice that there is a sort of a polyhedral shape to this virus, and you may be given a high magnification whereby you'd be able to pick that up. Also, interestingly, which you never see this by EM, but these viruses have little long spikes that come out of them called pentons, and these structures in and of themselves are cytopathic, destructive to cells. An interesting feature of adenoviruses. Now we get into a still larger DNA virus, which is the herpes virus. This is in the lung of a cat. I'm not exactly sure what cell this is, but you would look first for something like a herpes in the nucleus, because that's where it's synthesized. These are immature virions in here, and here is one budding out of the nuclear membrane, and in doing so, it's picking up its viral coat. So what happens first in all cells that become, or all viruses rather, that become encapsulated, the membrane is first studded with viral-specific proteins, and then the nucleocapsid buds through that and picks up its coat. Here you can see some mature particles out here, and there was another one. Well, maybe not there. But I have some more pictures. This is herpes B in a gibbon. And here you can see an immature virion here. And you can see once again how this nuclear envelope becomes very electron dense here and begins to encircle the virion to produce a mature particle here. Also remember with herpes and also some other viruses that it's generally the coated virus, the encapsulated virus that's infective. But by virtue of the ability of the virus to induce syncytiation in cells, paramyxoviruses are, I think, a good example of that, immature virions can be passed from cell to cell as well. So you may have cases where you don't see completely mature viruses, and they would be in a number of cells, and that might be the reason why. This is from a squirrel. I don't remember where the case came from. Not important, really. It's a fibroblast, or at least that's what we were pretty well convinced that it was, but there's nothing here to say that that's what it is. There's the nucleus here. The nucleus has an inclusion in it, and the inclusion is filled with filaments. And I'm still not sure what the filaments are. Who knows, maybe vimentin or something like that. But completely filling the cell is an inclusion. The inclusion has two different forms. One is roughly round and is honeycombed with holes, and is amorphous but more electron dense than the other inclusion. The other inclusion, as I recall, was somewhat filamentous. But anyhow, if you look through the inclusions, you see in various stages of maturity very large virions, and I have a bar marker here, but I can't remember how big that was. It looks like maybe 200 nanometers, 250, something like that. Very large virions, some of which contain a very dense dumbbell-shaped nucleoid in the center, and others which were less mature had no coat on them at all. And this, of course, is a pox virus, and this is a squirrel fibroma in a squirrel. Another pox virus from a mule in the cytoplasm, and the dumbbell-shaped nucleoids. You can also see the same thing in ORF or whatever. Okay, bacteria. This is a negative stain once again. Bacteria, of course, a lot larger than viruses. It's fairly easy to tell what's a bacterium and what's not, and I'll show you better photographs in a minute. But this shows fimbria or pili, which are used to study various bacteria. This is an ETEC, Enterotoxogenic E. coli, which the reason for showing this is that the Enterotoxogenic E. coli sit, or they don't just sit, but they attach, but they're right at the end of the microvilli. These are small intestinal microvilli here, and these bacteria attach right at the end of it. They don't penetrate into the microvillar brush border at all. And these are some neutrophils here that have come along and phagocytosed those organisms. In my way of thinking, it's almost impossible to tell what kind of bacterium you've got here. You've almost got to take the setting that you have. You've got a, maybe they may tell you it's a young pig or something like that, and you've got these bacteria sitting on the surface and maybe a cell that looks sick. And you put two and two together and make your interpretation. Now, this is a different type of E. coli. This is enteropathogenic E. coli. This bacterium not only penetrates the brush border, it attaches by way of a very intimate attachment zone. In areas where it attaches, microvilli are lost, and the term for that is effacement. The close attachment and the effacement gives rise to the name attaching and effacing E. coli. Okay. Also note that where microvilli have been lost on this cell right here, which is bulging out into the lumen, and there's a lot of condensation of the cytoplasm here, and some swelling of the endoplasmic reticulum, and rarefaction of chromatin in the nucleus. You could go on and on. Swelling of mitochondria in this cell here. But where you lose microvilli here, remaining microvilli will elongate, like here. And here you see tremendous elongation of microvilli. And this is the type thing you want to look for in intestinal cells where you have damage. The same is not true of an organism like Cryptosporidium, which we'll see in a little bit. They seem to be have a lot less effect on the cell when they attach. Cells seem to be a lot more able to cope with that. Another bacterium that can produce this same type of lesion is Citrobacteria freundii, I understand. I've never seen it firsthand, but in mice it can produce this close, oops, that's a scanner there. Just look how many bacteria are, and they're very happy here because where you see a little waste, there's a little waste right there on that one, they're dividing. And they're really quite happy. Microvilli are lost, the surface is smooth. And here's that close attachment. There's about a 10 nanometer zone, and there are little pili or filaments of some kind that are holding it onto that cell. It forms a little cup. Sometimes it's raised onto a little pedestal like a golf tee. And notice here that this is that the occluding junction here is beginning to become unzippered. The intermediate junction is a little wider than it should be, and it looks even like the belt desmosome is beginning to pull apart. That was my interpretation based on other views as well. This is Bordetella avium in the turkey trachea. Ciliated cells. You can see the cilia here. They're very uniform in their thickness. You can also see the basal bodies. That's a good clue. And then you have the bacteria, which have a mixture of being very electron dense and having a lot of granularity in there, a lot of nucleic acid and ribosomes and things like that. And then they'll have little electron lucent areas in there. They're bounded by a double membrane, which you can't see here. We'll see that on the last one. You may be able to pick out the double membrane in there. Okay. And not so typical in this one. There are loss of cilia on these cells here. They're just not as many as there should be. And the microvilli have really taken off. They're very plush in here. So it would I guess, make sense that when you lose cilia that the microvilli tend to not replicate, but they tend to maybe elongate a little bit, and their numbers may increase even. This is Carbacillus in the airway of a rat, I believe it is, and also notice the difference in the texture here. Very electron dense, very granular, maybe even a little wider than the cilia in here, which have a very uniform substructure. Okay, cilia, once again, this is a pig, and this is Mycobacterium. You have Mycobacterium, fairly pleomorphic bacteria here, a little more electron lucent than some of the other bacteria we were looking at. And here, once again, you have, it looks like, at least in this area right here, too few cilia, and that may be an interpretation you can make. Over here is Bordetella in a pig, and it looks almost in a way like some of the cilia have been shaved right off here. You can see the basal bodies remaining as well. A little neutrophil out here. So when you get something where you think that you've got something going on, a process with bacteria or something like that, look closely at the cilia and the microvilli for changes there. Okay, these are spirochetes. It's kind of dark here. There are also flagellated bacteria here, but I just wanted to show here that these can actually embed themselves to some degree into the surface of the cell. And this was in a monkey colon. I also believe that these spirochetes are non-pathogenic, although I'm not 100% sure. Okay, now this is very similar to a case that was on the boards a few years back. And it's a double whammy. It's the typical double whammy. Now, how you would actually tell where you were in this, given the history tissue from a hamster, it'd be very hard to tell. But to orient yourself, you'd almost need to have several more nearly normal cells. We had microvilli, and you'd be able to see that they have nice uniform length, and take a stab at the fact that they're intestinal. But these structures out here are various stages of Cryptosporidium. And there are so many Cryptosporidia here that the microvilli are completely effaced, except for maybe a few down here. And so you have almost total effacement of microvilli here. Cells are almost totally uniformly swollen. You see very little in the way of organelle here. Nuclei are also swollen, very little in the way of chromatin here. And also within the cytoplasm are these little structures, smaller structures here, which are bacteria. And I think we were supposed to think that they're Campylobacter or Campylobacter-like organisms in proliferative ileitis in this animal. But one mistake that I heard echoed after the exam, I may have attended the critique on this particular case at the ACVP exam, was that people got so, a lot of the attendees or testees became so interested in describing the parasites and the bacteria that they forgot to describe the cells. And remember that you can describe these protozoal structures very quickly by saying that there are various stages of a protozoan parasite ranging from trophozoites to cysts, mature cysts, and leave it at that and still probably come away with most of your points. But if you forget to describe the changes in the cells, you're not really doing the case service, I don't think. You're not doing yourself service either. This is leptospirosis in the kidney of a pig, I assume, and what you see here are swollen distal tubular cells. The endoplasmic reticulum in particular is swollen here, and the little arrow, which you can barely see there, is supposed to show in an interstitial fibroblast that there's a little squiggly shaped bacterium here. And to see another magnification here, this is the lumen of some of these, of one of these tubules down here, and you can't really tell much except that there's a tangle of microvilli here, and also some darker structures entangled in that tangle, and then some large vesicles in here, which are probably once again swelling of the ER. But if you look at a higher magnification of the tangle, you can see the more electron-lucent microvilli here, and then these darker comma-shaped spirochetes of lepto. It can be very, very hard to sort some of these things out. This is equine ehrlichiosis, Potomac fever. What I wanted to show here is that when bacteria are contained within lysosomes, you have the double membrane of the organism itself, which you can see nicely there, and then there's the additional membrane of the lysosome, the phagolysosome itself. Getting into chlamydia. Chlamydiosis in the intestine of a pig. There are large vacuoles in these enterocytes here, and they contain numerous, numerous stages of chlamydia or bacteria, whatever you want to call them. But it's important here, once again, to describe the changes in these cells, because the microvilli here are almost completely lost. This cell is about to slough out. The endoplasmic reticulum is dilated almost severely. And you've got all these cells down here, which I'm assuming are basal type cells, trying to move up or getting ready for the advent of the sloughing of all these cells. Higher magnification of chlamydia here. Well, there's a better example here. You have the very tough elementary body, which is able to withstand environment, a lot of different changing environments. The intermediate body with this little dense body here, and a larger, more fragile reticulate body. These are M cells of a bovid, a small, young bovid, and it's hard to tell. I mean, they have microvilli here, but they're not as well formed as what you'd see in an enterocyte. But these little dots here point to bacteria within phagolysosomes, and this is Mycobacterium paratuberculosis in a bovid. I think that in a board case like this, they would give you this magnification. If there are good changes in here, which there are not so much in this slide, they give you a higher magnification, so you can tell what's going on. This is a macrophage from a granuloma in the body cavity of a fathead minnow, which contained Mycobacterium fortuitum, and this is just to show you that if you compare the appearance of mycobacteria within these phagolysosome that are getting bombarded by the best enzymes that the macrophage can conjure up, and they look every bit as healthy as the ones on the outside. These are the cells that had desmosomes in between them, although there's none evident in this view. And this is the lung of a guinea pig. In an alveolar space was this neutrophil. There's another neutrophil over here, another one here. And they're loaded with bacteria. You can't really tell one from the other. Here's one that looks like it's dividing. It's perfectly happy. And this is Legionella. This is an experimental case, obviously. Legionella in the lung of a guinea pig. Okay, and this is Q fever in a placental cell of a goat. Just note that in bacteria, there are different appearances. This almost looks like one of the chlamydial stages there. It looks a little bit like the intermediate cell there with this little dense body in the center there. And then finally, the chorioallantoic membrane of the placenta of a goat, once again, I think. And these trophoblasts here are filled with what look a little bit like mitochondria from here, but they're actually it's Brucella abortus. It's a bacterium, and here's one trophozoite that's, or trophoblast rather, that's sloughing off. Okay, going through protozoa fairly quickly because I think Dr. Dubey probably covered a lot of this pretty well. But there are certain structural features I want to impart on you here. This is a macrophage from the blood of an AIDS patient, and these are zoites, tachyzoites in this case, of toxoplasma. Very sad. When I saw this, I was very sad. The tachyzoites, or zoites in general, have some fairly characteristic features. They have these long, thin structures which are called micronemes. And these, I understand, are structural, of structural importance. They have clear residual bodies. They look like little fatty bodies. They have nuclei, unlike bacteria. And they have an apical complex, which is important in penetration of cells. This is the conoid here, and there's a polar ring right here. There are also other structures, one called where they're paired rope trees, which are thicker, and I'll show you those in just a minute. This is to remind me to tell you that this is a Brady cyst, I think, because of the thicker wall here, that these zoites are within a distinct parasitophorous vacuole in the cytoplasm of the cell. So the milieu that they're in here is not truly cytoplasm. That's my understanding. This is hepatic coccidiosis in a calf. What we can see here are micronemes once again, mitochondria over here. And the mitochondria, by the way, are very helpful to a parasitologist in identifying or speciating a lot of these things. So it's not just something that I'm throwing out. In fact, the next case I will show you was identified, speciated based on the mitochondria. And these are residual bodies here. And once again, it's within a vacuole. This is Isosperous serenii, which was diagnosed in a Ballymena at the National Zoologic Park. There are some nice rope trees or rop trees here. I'm not sure what the function of these things are or is, but there they are. And I think in a case on the boards that you would want to describe those things if you think you have time. But the idea is not to get into every single bloody detail of a parasite. You haven't got time to do that. It's probably more important after the board to, in a good case. Now, I threw this slide in. This is Sarcocystis. I'm not sure of the tissue or the species, but what I wanted to impart here, the reason I threw this in, is because these zoites of Sarcocystis are present here free in the cytoplasm of the host cell. And I thought to myself on the way here, this is kind of silly because one of the most common things you see in a bovid is a nice big cyst in the muscle. So a distinguishing feature, as was pointed out in a book by Dr. Chris Gardner, and he points out in that book that one way you can distinguish this coccidian, Sarcocystis, from others is that this is free in the sarcoplasm of muscle or what have you, whereas I know that that's not always the case, and that's supposed to be a distinguishing feature from other coccidians. If there's somebody here that knows exactly how that works, I'd be interested in hearing it. It may be that in the acute phase of sarcocystosis that the the zoites multiply in endothelial cells and are there free in the cytoplasm. I'm not really sure. But anyhow, this is sarcocystis. Once again, it's typical coccidian stages there. Okay, this is cryptosporidium. This is a non-pathogenic form in the ileum of a rabbit. These microvilli are very short for ileum, but that's what they are. This, you can see the attachment here. These are trophozoites here, and where the little beasties attach, there is localized effacement of microvilli, but the other ones surrounding it are not changed whatsoever. And I think other than some artifactual expansion of ER here, endoplasmic reticulum, that the cell itself has not changed much at all. To look at a horrible photo mic, which I took, the epoxy, which is used in processing, embedding tissues for cutting very thin sections for EM, actually fell out of this. That's why it looks so bad. But this is a cyst, and these are meronts inside. And with cryptosporidium, they have a little coiled structure here, which I believe is called a feeder organelle, which is fairly characteristic of that. And I'm pretty sure that this is the organism, although I may be wrong, that is supposed to be also enclosed by the host's plasma membrane, although it's not truly in the cytoplasm. And this is a scanning EM in the ileum of a lot of those little trophozoites that I just showed you of Cryptosporidium rari. The more interesting thing here is you can see the outlines of the little cells. Okay, that's what that is. And then the fuzz on the cells, the velvety appearance is the microvilli. This is Giardia, almost looks like a red blood cell, but if you look at some of these other, this is very hard to see. You can see these little thin filamentous flagellae on there, and that gives it away. When you see it by transmission EM, it's actually laying, once again, right on the surface of the microvilli, and it has a little adhesion disc there. And finally, pneumocystis carinii in the lung of a human, I believe. This is a cyst right here with little meronts, I guess you'd call them inside. This is a trophozoite, and collapsed cysts right here. So there's a lot of similarities between a lot of these organisms that I'm showing you, and that's the reason for showing you these things. Oh, I guess finally is Babesia bovis, and the margination and sequestration, I guess you'd say, of red blood cells infected with these babesial forms in a cerebral vessel. Very similar to what happens in something like Plasmodium vivax in people where they get cerebral malaria. And the interesting thing here on close examination, look at these little processes here of the endothelial cell sticking up and the little invagination of the red cell there, which was, I guess, the mechanism by which they hold on so well. Oh, I also threw in Cryptococcus, and just to show you that it has a nucleus, it has mitochondria, it has this nice slime layer around here, and then to compare that with Blastomyces right here. I'm not sure of the tissue on this. This just appeared. It has a nice sort of a thick wall, cyst wall on it. Neoplastic, I want to make sure I get through because I think if I convey no other message to you than this, I guess I'll be happy. But the whole purpose of using EM on a neoplasm is not to determine malignancy at all. It's to determine the histogenesis of the tumor and thereby make some kind of prognostication for the patient. And as you can see in this one, this is an Oxaphil Adenoma in the parathyroid. If you were to compare this with normal cells, other than the fact that this might have sort of a large nucleolus here, and the fact that you have a monotonous population of cells here, these cells might, for all the world, look normal. So this is Oxaphil Adenoma. That C-cell neoplasm that I mentioned I'd show you before, the parafollicular cells, they have dense core granules in them. And you're not going to see that in any other tumor in the area of the thyroid. One thing that will look like this in the larynx also is an oncocytoma of a dog. Has been reported in dogs anyhow. They're loaded with mitochondria, just like that. Okay, I'd ask questions if I had more time, but what's this? It's in the area of the pancreas. It's a beta cell tumor, and there's no question about it because of that bar-shaped crystalloid right there. Okay, getting down into a tumor of the adrenal, and here we have these vacuoles with a very dense core, a huge halo around here, and an eccentrically placed granule. This is a pheochromocytoma, which is producing, in this case, norepinephrine. To see its counterpart, which is producing epinephrine, we have these garden variety apud granules, which have membrane, very thin halo, and a very dense core. And that's the way you can tell those two apart. Okay, also in an adrenal tumor, if you get a fairly normal looking cell, except maybe for the large nucleolus there, with repetitive, very sized mitochondria with vesicular cristae, you would naturally think of an adrenal cortical tumor. And there should be quite a bit of SCR in there. Okay, I just threw this in. I don't have any photographs of a carcinoid tumor, but in human medicine and human pathology, the shape, the size, and the distribution, the numbers, and things like that of the dense core granules in these carcinoid tumors is very important, because they will help the pathologist determine where the tumor came from, and that gives them some sort of index for prognostication, once again. Okay, this is from a cell from a tumor from the neck area of a dog. A lot of mitochondria, once again. This is formalin fixed, by the way. That's why it looks kind of raggedy. And here we have a portion of a myofibril with two Z lines in here, and this is a rhabdomyoma. The oma, or rather than myosarcoma, was determined at the light microscopic level, okay, not at EM. Now here's a rhabdomyosarcoma with, fortunately, very nicely developed fibrils here. Look at the A band here, the electron dense Z, not Z, I band, and a nice dense Z band there. What you're more likely to see is this, where you have very primitive sarcomeres being formed, and you're just getting these very crude looking Z lines, and that would help make a diagnosis along with other things. Oops, I guess I need one more carousel, and we're just about done here. Okay, this is a leiomyosarcoma. Rather than having a lot of Z lines in here and well-formed sarcomeres, we've got a lot of intracytoplasmic filaments in here, and also in leiomyosarcomas or myomas, there tend to be a lot of pinocytotic vesicles, which are not readily evident here. Okay, now in human medicine, it's very important to distinguish between a pulmonary adenocarcinoma and a mesothelioma. And with us, I don't think we see them that often, but one of the big differences is, other than a lot of different stains you can do, and chemical stains, I mean, that the microvilli of the adenocarcinoma are shorter and stubbier, whereas in the mesothelioma, they're more plush, and they're longer, and they're thinner. Remember that mesotheliomas, even though they're of mesenchymal origin, although they do have some epithelial markers, they're mesenchymal, they have very plush microvilli, they have desmosomes in between, and they have a very thin basal lamina, which you'll see on inspection of the tissue. A monotonous cell population in the lung of a sheep, or maybe it was a goat, I can't remember which. It's hard to tell what type cells these are until you see these little secretory granules up here, and they look like Clara cells, and that's what they are. It's a pulmonary carcinoma of a sheep. Okay, now in neural tumors, this is a pattern that you see in, this is a perinasal meningioma. And you tend to have very elaborate cell processes, and these interdigitate with one another. A lot of times you will have indented nuclei, which is present in this case. You can have desmosomes. Sometimes they're very aberrant. Here's one there, and there's a very, well, I guess fairly aberrant one there as well. In some other neural tumors, there are some other features. This is an ependymoma. In cells that tend to line lumina, when they become neoplastic, will sometimes form intracytoplasmic lumina. And if they have microvilli in health, they will tend to try to form, well, will try to form them in the neoplasm. And here you see an intracytoplasmic lumen within a neoplastic ependymal cell. And these are the microvilli in here. This is the base of a cilium. And it looks very much like a basal body. Sometimes you just see a little basal body-like structure beneath the surface there. And at the light microscopic level, I know that once we stained the tumor with PTAH, which will show up the basal bodies very, very nicely if they're present. Also look at these wild desmosomes here. There's another one over there. Pendimoma. This is a secretory granule, and the significance of that is unknown. I'm not really sure. I don't remember ever seeing anything like that in a normal cell. This is a peripheral nerve sheath tumor of a rat. And once again, it's hard to see here. Very long, elongated cells, elongated processes, interdigitating. Some desmosomes, I'm not really finding them here. There's a very thin basal lamina here. And you have these concentric laminations of membranous type material, which have a distinct periodicity. And I'm not sure that this is in a Wistar rat, but in the Wistar rat, tumors like this, these scrolls here have been shown to be composed of myelin. And I think in a regard it's a model for the similar tumor in man, except in people there is no myelin in these scrolls. Okay, malignant melanoma, just to show you various stages of melanosomes. I took my other one out, but sometimes in some of the early ones you'll see filamentous, parallel filaments in the melanosomes, or some with cross-hatching. Here you can see a little linear density there. And you just take your best, oops, I went backwards. You take your best guess at them. This is a malignant melanoma with only pre-melanosomes. Here you can see some little membrane-bound structures with just very difficult to see, these little filaments in there. And here's where you'd pull out the Wirth and Starry and see if that works to try to diagnose this tumor. This is a chromatophoroma in the skin of a snake. These cells are contractile. They are the cells which in health are able to give skin an immediate change of color in cold-blooded vertebrates. And this is a neoplasm of that. Remember that on the boards and in life, you're not going to be restricted just to mammals. So something like this could come up. This is a Schwann cell tumor, and it's an endocardial tumor in a rat. This is to show once again the fact that it's an elongated cell with very well-developed cytoplasmic processes, which you get a feel for here. You can't really see them. There's a nice basal lamina there. And I think a lot of neural tumors, it's been my impression, at either the light or electron microscopic level, that you get nice margination of chromatin all the way around there, sometimes a very dense ring around there. Oh, also remember that in schwannomas, they can be pigmented. Okay, you can see melanosomes in there. Okay, in fact, this one slide I threw out, which you didn't see that had melanosomes in there, was from a Schwann cell tumor. This is a granular cell tumor. It's a real nice one because they're usually, it's a nice tumor because there are usually features of a granular cell tumor that can help you make the diagnosis fairly quickly. They contain large, this is from the endometrium of a rat, by the way. They contain large membrane-bound lysosomal structures which contain garbage. They contain myelin figures, they contain flocculent densities. The next slide maybe shows it a little bit better. Here's the lysosome here. Homogeneously electron dense, granular material down here, and sometimes myelinoid scrolls like this. Several other things that you can see in granular cell tumors that can help make the diagnosis, which I don't have a photograph of. One would be a structure called an angulate body, which is roughly, I would guess, 2 times the size of a normal mitochondrion. It's membrane-bound, it's usually elliptical, and contains filaments, and they're usually parallel. It's sort of a very electron-dense structure, an angulate body, and this is the only tumor I know that contains that angulate body. The other thing that you can see associated with these tumors in the can see melanosomes in there. Okay, in fact, this one slide I threw out, which you didn't see that had melanosomes in there, was from a Schwann cell tumor. This is a granular cell tumor. It's a real nice one because they're usually, it's a nice tumor because there are usually features of a granular cell tumor that can help you make the diagnosis fairly quickly. They contain large, this is from the endometrium of a rat, by the way. They contain large membrane-bound lysosomal structures which contain garbage. They contain myelin figures, they contain flocculent densities. The next slide maybe shows it a little bit better. Here's the lysosome here. Homogeneously electron dense, granular material down here, and sometimes myelinoid scrolls like this. Several other things that you can see in granular cell tumors that can help make the diagnosis, which I don't have a photograph of. One would be a structure called an angulate body, which is roughly, I would guess, 2 times the size of a normal mitochondrion. It's membrane-bound, it's usually elliptical, and contains filaments, and they're usually parallel. It's sort of a very electron-dense structure, an angulate body, and this is the only tumor I know that contains that angulate body. The other thing that you can see associated with these tumors in the matrix around them is long-space collagen. Okay, this is a hemangiopericytoma. They're elongated cells. They tend to have a lot of intracytoplasmic filaments. They can have a lot of cytoplasmic